Hello, everyone, and welcome to Heart of Healing. First off, let me just say I am so honored that you've decided to spend this time with me today. It shows your dedication, not just to expanding your knowledge, but also to making a real difference in the lives of your patients. And that's something I truly admire. Now, the purpose of today's episode is to fully dive into the world of cancer pain management. This is such a vital topic, one that directly impacts the quality of life for so many of our patients. As nurses, understanding this is frankly non-negotiable in the level of care we aim to provide. We're going to explore how pain is assessed, the different therapeutic strategies available, and the barriers to effective care. By the end of our time together, my hope is you not only feel more informed, but also a little more empowered to take what you learn here into your practice. Let me give you just a quick preview of what's ahead. First, we'll take a closer look at how cancer pain is classified, like whether it stems from the tumor itself or the treatments patients undergo, such as surgery or chemotherapy. From there, we'll discuss how we as professionals assess pain, beyond just what patients report verbally. And then we'll dive into the treatment approaches, ranging from medications to interprofessional collaborations, and even alternative therapies that can enhance patient well-being. But as we go through everything today, I want you to mentally picture your patients. Picture the faces, the stories, the tiny moments that remind us why we choose to serve in this field. I'll share clinical experiences and real-world patient scenarios to make these strategies and concepts come to life. Because at the end of the day, this isn't just about theories or tools. It's about the human being we're caring for, supporting, and guiding through some of the most challenging moments of their lives. All right, let's start with a foundational understanding of cancer pain. It can generally be divided into two main categories: tumor-related pain and treatment-related pain. Tumor-related pain is caused by the physical presence of the tumor, which can press on tissues, bones, or even nerves, leading to some really intense discomfort. On the other hand, treatment-related pain usually stems from procedures like surgery, radiation therapy, or chemotherapy. It's kind of the collateral damage of life-saving interventions, but that doesn't make it any less real for our patients, right? Now, when it comes to assessing pain, this is where being observant and methodical really matters. The most reliable tool we have, it's not a fancy device. It's the patient's verbal expression. We absolutely have to take what they say seriously, because they are the experts on their own pain. But of course, we also have standardized scales that help us dig deeper into essential details, like the intensity, location, and quality of the pain. For example, is it sharp, dull, throbbing? Understanding these nuances can guide our approach to care so much. But here's the thing. Not every patient can verbalize their pain clearly, right? Some might be nonverbal, or maybe their pain is so overwhelming they just can't articulate it. That's when we need to look for those nonverbal cues. Things like grimacing, agitation, or even physiological changes, like elevated heart rate or perspiration, can give us critical insights. And we can't overlook chronic indicators either, like withdrawal, lethargy, or even unexpected emotions like anger or depression. Each of those is a piece of the puzzle. Unfortunately, even with all these indicators, there are still some real barriers to effective pain management. For one, there's often a knowledge gap, not just for patients, but for us as healthcare providers too. Patients might hesitate to share the full extent of their pain because they're worried about being seen as weak, or they're wary of medication side effects. On our side, I think we've all seen situations where inadequate assessments or misunderstandings led to undertreatment of pain. It's a humbling reminder that education and communication are absolutely crucial on both ends. Now let's delve into the tools we deploy to manage cancer pain pharmacologically, and when necessary, invasively. Let's start with medications, the cornerstone of pain relief in most cases. Non-opioids like NSAIDs, think ibuprofen or aspirin, are often our first line of defense. These are especially useful for mild to moderate pain, and they come with the advantage of targeting inflammation. That said, we've got to be vigilant about side effects, right? NSAIDs can irritate the stomach lining, potentially causing gastrointestinal bleeding. That's why assessing each patient's risk factors and educating them on safe usage, like taking these medications with food, is so critical. Now, when pain escalates to moderate or severe levels, opioids often become the next step. Medications like morphine, fentanyl, or oxycodone are powerful, but they're a double-edged sword. On one hand, they can provide profound relief for even the most intense pain. On the other, they come with risks like respiratory depression or, let's not forget, the dreaded constipation, a side effect I think every nurse has fielded complaints about at one point or another. And of course, there's the stigma surrounding their use, which can make both patients and providers hesitate. This is where clear communication becomes so vital, so we can ensure these medications are used appropriately and effectively. Beyond these primary options, we've also got adjunctive therapies that target specific pain types. Antidepressants, for instance, like tricyclics or SNRIs, serve a dual purpose. Not only do they alleviate certain kinds of neuropathic pain, think burning or shooting sensations, but they also stabilize mood and improve sleep quality. Similarly, anticonvulsants like gabapentin or pregabalin can be lifesavers for neuralgia. These drugs calm overactive nerve signals, essentially dialing down the volume on those pain pathways. But again, patient education matters so much here, making sure they're aware of potential side effects like dizziness or sleepiness, and encouraging them to report anything unusual, like a rash. And when medications alone don't suffice, we turn to invasive interventions. Regional nerve blocks are a great example here, providing localized relief by essentially interrupting the pain signal at its origin. They're especially effective for patients with refractory or site-specific pain. Then we've got epidural catheters, a method most of us are at least somewhat familiar with in other contexts, right? They allow for continuous pain relief, often with lower doses of medication compared to systemic options. Both approaches, while more invasive, can drastically improve the quality of life for patients dealing with complex or persistent pain. All right, when it comes to pain management and cancer care, we often focus on medications and procedures. But there's a whole world of complementary therapies that can dial down pain, enhance comfort, and even improve quality of life without relying as heavily on medication. Let's start with TENS, or transcutaneous electrical nerve stimulation. This method uses low-voltage electrical currents to interrupt pain signals, and honestly, for some patients, it can work wonders for localized pain, especially when other treatments fall short. Then there's massage therapy. I mean, who doesn't feel a bit lighter after a good massage, right? Beyond just feeling nice, massage can reduce muscle tension, improve blood flow, and even release endorphins, where I just see our body natural painkillers. And let's not forget acupuncture. This ancient Chinese practice might sound a little foreign or, intimidating to some, but the evidence behind its ability to relieve certain types of pain is growing. By inserting fine needles at specific points on the body, acupuncture helps restore energetic balance and, in practical terms, can reduce inflammation and nerve-related discomfort. Now, integrating these therapies into a patient's care plan isn't just about saying, hey, let's add acupuncture to the mix. It takes a collaborative effort from an interprofessional team. We're talking about oncologists, nurses, physical therapists, and even licensed acupuncturists, all of whom work together to tailor an approach that complements the medical treatments patients are already receiving. By customizing these care plans, patients can experience not just pain relief, but a fuller, more holistic sense of well-being. And the impact of these approaches isn't just theoretical. Let me share an example. A patient struggling with chronic pain after extensive chemotherapy and radiation. Traditional medications alone weren't cutting it, so the care team incorporated mindfulness-based stress reduction. This involves guided meditation and focused breathing exercises, helping the patient manage their pain perception and stress levels. Over time, not only did their pain decrease, but they also reported sleeping better and feeling more in control of their situation. It's stories like these that remind us how powerful holistic care can be. All right, let's take a moment to step back and reflect on some of the most important points we've covered so far. You know, a big takeaway that really stands out is the complexity of cancer pain itself. It's not just a physical experience, it's deeply interwoven with emotional and psychological elements. That's why holistic assessment is so critical. Whether we're relying on verbal reports, standardized measures, or those subtle nonverbal cues, our ability to truly understand a patient's pain sets the foundation for everything else we do. And speaking of doing, let's not forget the range of interventions available to us. From pharmacological treatments like NSAIDs and opioids, to more targeted therapies such as nerve blocks or antidepressants, each tool has its place. But what really struck me as we explored these options is how essential education is, both for us as providers and for the patients in our care. You know, empowering a patient to understand how, when, and why we use certain medications can fundamentally improve outcomes. But beyond the medications and procedures, it's the integrative and alternative approaches that really remind us of the art in nursing. TENS, acupuncture, mindfulness-based strategies. They give us a way to meet patients where they are, often offering relief when traditional methods fall short. And the best part? These approaches don't just treat pain, they promote comfort, dignity, and even a renewed sense of control for patients navigating what may be one of the hardest chapters in their lives. And let's not overlook the bigger picture here. Everything we've discussed, whether it's pain assessment, pharmacological strategies, or holistic care, comes back to one central idea: improving quality of life. That's not just a theoretical goal. It's about creating moments of peace, supporting a patient's mental clarity, and ensuring they feel heard, valued, and cared for at every step of their treatment journey. As we come to the end of today's episode, I want to leave you with a thought to carry forward. Every step you take in refining your skills and deepening your understanding brings you closer to excellence in nursing. It's a journey, not a sprint, and one that's profoundly impactful for the lives you touch. And let me remind you, you're not alone in this. We're all navigating this path together, guided by a shared purpose of compassion and care. I know we've covered a lot today, from the importance of assessing pain to employing the right interventions to embracing holistic approaches. If you ever feel uncertain or have questions, please don't hesitate to reach out. And be sure to explore the additional resources I've shared with you on Canvas and in your texts. They're there to support you, just like I am. Lastly, I'd love to hear from you. Your feedback and insights are invaluable and help me create content that genuinely supports your learning journey. So don't be shy. Share your thoughts, your questions, and even your challenges. This is a space for growth, and you are a part of that process. And with that, I want to thank you for joining me today. Your commitment to learning, to reflecting, and most importantly, to the patients you serve. It's inspiring, truly. Keep moving forward with confidence, knowing that you're making a difference every single day. On that note, I'll see you next time. Take care and be well.